Hi everyone. So welcome to the mini tutorial on study biases. So today we're specifically going to look at the types of biases that can occur in epidemiological studies. So you will find this mini tutorial very helpful when it comes to not only your quiz that you're going to have, so you are going to have a second quiz, this module, and for your final exam. So again, definitely bookmark or view this mini tutorial. It'll help you a lot on those two things. So let's get started. Let me share my screen. And here we go. So again, by now, I apologize that this was in the wrong spot. By now, you should have watched Study Validity, and you might be watching this as the second one. Again, I'm not sure the order that you guys all watch these, but you should have definitely watched the Study Validity mini tutorial. So in that one, we ended in talking about systematic types of errors, right? So a systematic error is what we call bias. So that's what we're going to talk about today. And the reason why these are so important is because a bias can cause a really severe change in your estimates, your measure of association, right? So it could be your RR or your OR. And notice on this slide, I do mention something about bias away from the null and bias towards the null. So those are concepts that I'm going to cover in a different mini tutorial. So I decided to split it all up because it'll be easier for you. But make sure you read those because I will ask a question or two with regard to how biases can impact the strength of the associations. Okay, so please make sure you do that. So these are the types of biases we're going to talk about today. So notice how I made a nice little flow chart for you. This is actually new. I didn't have it in my old lectures, but I realized that I needed something like this to keep all the types of biases clear in your mind. So there's different kinds of biases. We split them up into, there's actually probably more than these, but these are the primary biases that we're going to talk about. So when you're studying, if you come across a different bias that's not covered here, don't worry about it. Just acknowledge that other biases can exist, but we're only going to cover a few in this class. So these biases can be split into observational biases, which are here on the left, and selection biases. And then under observational biases, we're going to cover recall bias, interviewer bias, and misclassification bias. Then for the selection biases, we're going to, there's basically, it's just one, but they differ depending on the study type. So we're going to cover the selection bias in the case control and the selection bias in the cohort study. All right, so there's basically 5 biases that we're going to talk about. And again, it's important for you to bank this in your mind because I'm going to specifically ask you to talk about these in your final exam. So very, very important that you pay attention to all of these. So the observational bias, to me, this one's a little bit easier to understand than this selection bias. So everything that falls under observational bias has to do directly with the type of methods or methodology that you use to collect the data. And it can be coming from, these could be errors that come from the investigator or the investigative team, or it could be something that comes from the participant. So it could be either, and I'll explain the differences in the next few slides. But there's several types of bias that we're going to cover, as I mentioned earlier, were the recall, interviewer, and then 2 types of misclassification bias. Great, so the recall bias. To me, this one, again, very intuitive. It's, if you know the word recall means remember or to remember, right? It's a synonym for that. So recall bias is simply that the participant has a difficult time remembering or accurately remembering something that they're being asked about. So obviously this has to do specifically with survey questions. When we ask participants something like, do you recall what you ate yesterday, which, sounds relatively easy, but you'd be surprised how difficult it is to remember what you ate yesterday. So again, so the problems with recalling, so one of the ways we fix this is that we have to be very, we have to standardize the way we ask the questions, and we have to be very thorough in the way that we ask them. Also, one other thing at the bottom, so I didn't talk about masking the participant or the subject, the study hypothesis. And the reason we do that is because sometimes if the participant knows exactly what your question is, sometimes they'll be influenced by that and they'll have either a harder time remembering or an easier time, or they'll make more of an effort to remember. So a lot of times we do want to mask the participant from knowing what our question is. Let me give you an example. Right, for all of these, I'm going to have examples so that you all can understand these a little bit better. In the image, there is a picture of a form that is we use for what's called a dietary recall. And a dietary recall is like what it sounds like. We ask people to recall what they ate, and typically it's what they ate the day before, and we ask them for what they ate during a 24-hour period. So recall bias is very, very common in dietary recall because what happens is that some groups of people may remember better or worse than others. And the example that I'm giving you here is that, let's say diabetic patients, right? So I work a lot with diabetes and that issue. So would you do, I want you to think for a minute why a diabetic patient might remember much better what they ate than people who don't have diabetes. And you might think that's a little weird. Maybe you would think it'd be the other way around, but it's actually that diabetics tend to know much better what they ate. So pause for a minute if you want to think about it. Maybe you've already thought of it, but some of you who have people with diabetes in your family may already be like, yeah, I know why, right? But some of you may not. So the reason is basically that diabetics, once somebody has diabetes, they really have to monitor their blood sugar level. So for that reason, because they're engaging in extreme monitoring, they actually are encouraged to keep journals and records of what they eat. And they have to be very careful of the amounts of sugars they eat. And they have to eat more fiber. So there's all these extra things that they have to watch out for. Sometimes also salt intake and things like that. So when we're doing studies where we're comparing people with diabetes versus those who don't, sometimes the diet recall can be a problem because we know our diabetic patients are probably going to remember much better than those who are healthy, who just eat whatever they want and they don't really care. And they're like, yeah, I ate like, a couple of candies, but they really ate the whole bag, right? So that's a very classic example of a recall bias. So, yes, I'm sorry, recall bias. Okay, next one, interviewer bias. This one is purely lands on the responsibility of the research team. So the interviewer here is influenced by the research question. And what happens is they may differentially treat participants different based on what conditions they have or exposures they've had. So basically is that if the interviewer knows what the research question is, they may be trying to get or fish certain information from certain participants so that we can prove our hypothesis. And that is a very bad thing. We do not want that, right? We do not want uneven methods of how to collect data, because that means will cause a bias, right? That's why this is called interviewer bias. The interviewer can cause this problem. And the solution for this is basically to mask the interviewer. So the PI, right, the lead researcher, will intentionally not tell the interviewers, the staff who are interviewing, what our exact hypotheses are. Of course, they know what the study is about and they know the topic and all of that. But what we do is we try to just not tell them exactly what we're looking at. That way it won't bias the interviewer to treat the participant differently when they're collecting the data. And again, we also want to use standardized questionnaires and standardized methods. And by doing that, we try to eliminate both recall bias and interviewer bias. So in a way, you could say that there's a couple of easy solutions for the two biases we just talked about, right? Standardized methods and masking both the interviewer and the participant from the hypotheses, right? And the specific research questions. So those two things will really help. So pretty easy to deal with these biases. The example here also has to do with diabetes. So here the example is talking about how the data collector might be interviewing people with type 2 diabetes versus those without. So again, we have the two groups, with or without disease. And let's say, for example, the interviewer, while conducting the dietary interviews, would be really aggressive with, let's say, for example, the diabetes group, partly because they know that diabetics are better at remembering. So they're going to be, if they're not remembering, they're going to really probe them and get really quality data from those participants. Whereas with the control group, since they know they're not going to remember, they might just be like, well, you don't have diabetes anyway. And they're just lax about their method. So again, we have to standardize the method of how to collect the data. So, so there you go. So there's bias number 2 under observational bias. Let's do the third one, which is misclassification. So earlier I said we would cover 2 types of misclassification, but let me just talk about misclassification bias generally, and then I'll explain what the difference is between differential and non-differential. So first, before I go into any of this one does require you to spend a little more time and understand this figure that I'm, moving my arrow around right now. You need to understand the figure really well in order to understand these biases. Once you understand the figure, the definitions are very easy to understand. So let's look at this. And I should have, this is not my figure. It's a brilliant figure, I feel. It's the best figure I have found to explain misclassification bias. And I put the link down here to give credit to the people who created it. But let me explain the legend. So let's say that so obviously the happy faces represent, the circle of happy face, right, represent a person, okay, a subject in the study. So, there's all of these people are participating in the study, and all of these people in this box represent, imagine instead of saying there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 people in cell A, we're just representing it visually by showing you the faces. So by doing that, we can now put characteristics applied to them, so it can be really obvious to you who's who. So notice that some happy faces are red and some are blue. So the red happy faces, notice there's red happy faces here and here mostly, and then there's a couple here. But the people who are red happy face are people who have the disease. I know there's a couple here, but we'll talk about why there's some that are in the strange group. Okay, but all of these red happy faces are people with disease. And then conversely, all the people with the blue happy face are non-disease people. And most of them are in these 2 cells. That makes sense, right? That's what I've taught you. This column always represents all the disease people. This column represents all the non-disease people. Now let's go across this way by row. In the rows, everybody who has a dark circle around, notice that some have a dark circle and some don't. So the ones with the dark, heavy black circle represent people who were exposed to whatever condition we're studying, right? So notice that most of these have a black circle and most of these have a black circle, but there's a couple down here, but we'll ignore those for now. These are supposed to be all people with the exposure. And then down here, you notice that all these happy faces, regardless of the color, most of them do not have a deep, dark black circle. Most of them have a light one, but there's a few of them who have the dark, but we're going to ignore those. But again, the non-exposed do not have the dark circle. That's the way it should look. If this was a perfect image, they would all match the description I just gave you. However, there are some that don't fit where they're in the wrong place, right? They don't fit in the right place. This is where it comes to definitions. This is why we use the word misclassification. So let's take this group. We started with the disease group, right? So we said all of these were supposed to be red. However, this blue one and this blue person over here were misclassified. And the reason they were misclassified had to do with some sort of error in the method, in the way we collected whatever we used to classify them, whether it was a survey, whether it was blood to measure sugar, or urine to measure a protein. Whatever method we used, there was some mistake that caused this person who should have been over here, to be classified here, or this person who should have been up here to be over here, right? So this one, the one I just described, is the disease misclassification because the wrong color is in the wrong group. Now there's also, that's this definition. Now there's also exposure misclassification. So these are these people here who do not have a dark circle, who should have had a dark circle, or these two also should have been down here somewhere, but they're not. So these are exposure misclassifications. That's basically what it is. So misclassification bias means that too many people are accidentally placed in the wrong groups. And the reason this happens again has to do with the method, that whatever method we use to classify people, there was an error in it. Now, it could be, remember we talked about random error versus a systematic error. So if this happens randomly and it's just a few cases, it's not such a huge deal. It kind of cancels each other out. With the misclassification bias, what happens is there's too many of these. There's so many that are mismatched that it causes for there to be an error in when you calculate the odds or the relative risks or the comparison of prevalence. So what we want is to minimize these errors so that we can avoid misclassification bias. Now you're probably wondering, okay, great, I get it, right? We don't want to misclassify people. So what's the difference between differential and non-differential? So differential misclassification bias basically means that there's a big difference between those who were misclassified by exposure versus those who were misclassified by disease. In other words, let's say, for example, the bias for exposure classification is just a lot greater. There's way more people who are misclassified by exposure than there were by disease, or vice versa. Right? That's what's differential. It's different. The exposure classification is different in the amount, right? In the magnitude in comparison to the disease misclassification, or vice versa. If it's non-differential, it means that these two exposure and disease misclassifications are about equal. They're about the same. So when they're about the same level, right, or magnitude, it usually sometimes it cancels each other out in the equation, and it doesn't really impact our or as much. So the one that we want to avoid more than anything is the differential misclassification bias. So hopefully that makes sense. When it comes to, I'm going to cover this again later, but when you're doing your final exam, don't worry too much about, distinguishing too much between all of these three. I really kind of just want you to understand that there could be errors on misclassification of exposure or disease. I wouldn't really ask you to do any, calculations or super explanations about it, but I kind of needed to just give you, sometimes you have to give you the details so you understand the bigger picture, right? So hopefully this makes sense. All right. So let's move on to selection biases. So we're done with observational biases. We've covered 3 of them. So now let's go to selection biases. And notice I'm trying some new looking slides here, but I don't know how much I like them, but it's just one slide. So I'll try something new. So these result from different procedures to select subjects. So this doesn't have to do anything. Selection biases don't have anything to do with the way we measure the data. It has to do how we recruit basically participants and from where. So what happens with these is that they differ a little bit with the design type. So that's why I'm going to talk to you first about case control selection bias and then cohort study selection bias. In a cohort study, for example, or an experimental study, my apologies. So what I just talked to you about, the way we select participants, so that is actually more specific to case control and retrospective, which I made the note here. And then sometimes when we lose participants to follow up, in other words, either we're tracking them and they decide to fall out of the study, or we lose track of them, or sometimes if we can't obtain data from participants from the past, Sometimes that'll be a problem. So that'll be a problem with cohort studies and experimental studies. Again, I will go over this with an example so it makes more sense. So let's go to our example with a case control. And this is just text you can read on your own. I'm going to talk about this in the example. So I'm just going to skip through the slide, but you can study it on your own. So let's jump to the example. So I'm going to show you two case scenario, same case scenario with a difference in how the control group was collected, the participants for the control group. So let's say your research question is, do pap smears prevent cervical cancer? So your exposure is getting a pap smear. Your outcome is cervical cancer. And let's say, again, this is a case control, so you're using medical records. And let's say you get cases, you select cases from a city hospital, and then you decide, the investigators decides that they're going to sample people who do not have cervical cancer from people who are already going to the hospital. So people who are also going for treatment and other things, but as long as they don't have cervical cancer, women who don't have cervical cancer, they could serve as a control. So let's pretend, these are some numbers that we derive from that case control study, and then we get an OR of 0.44. Remember, that's less than 1, right? So, okay, cool. That means that the exposure, having a pap smear, is protective. That makes sense. And if we were to interpret this, we would say women with cervical cancer had a 56 reduced odds of having a pap smear compared to those women who did not have cervical cancer. Great. Okay. So that all seems to be making sense, right? There's no problems. But I do want you to notice one thing. Notice that about 40% of the cases here in this row, about 40% of cases had pap smears versus 60% of the controls. So in this case, this way. So 40% of this group had a pap smear, and these, about 60% of the controls had the pap smear. So I just want you to bank that little bit of information, not just because it becomes kind of important in the next slide. Okay, now let's say we take the same scenario, but instead of using a control group where you use the hospital participants, instead you're going to choose controls randomly sampled from your local neighborhood. And you're probably wondering, all right, and that's perfect. Just so that you guys know, there's nothing wrong with that. It's just a choice, right? So sometimes researchers were limited to where we can sample from. Sometimes it's easier to sample from one area than another. So there's a lot of various reasons why we can select controls from one place versus another. So here's another case. And I apologize that let me quickly fix this because you can't see it. Although you'll be able to see it on your slides, but I wanted to fix it. So now let's say, because of this change you made here, there's going to be a change in these numbers right here. So when you recalculate, so let's go back really quickly. So in this case, there's 150 people who had pap smear. And in this one, there's only 100 who had it and 150 who did not. So when you run this odds ratio, you get a different result. You get 1.0, which is no association. So again, interpretive sentence, the odds of having a pap smear was the same amongst women who had cervical cancer versus those who did not have it. That's a totally different result, right? And you're probably thinking, you should be thinking to yourself, why? Why am I getting a different result? And notice here, 40% of cases and 40% of the controls had a pap smear versus 60% here. So clearly the change, the reason why I wanted to do this calculation about the number of women in each group who had the exposure was so that you could see that there was a clear difference in the amount of women who had the exposure in the control group. There's less women here in this neighborhood control group who had the pap smear versus in this hospital control. So the big problem then with this is basically, where do you sample from, right? How do you know which is the right control group because you're going to get a different answer. One of them is going to tell you that pap smear is protective. The other one's going to tell you that it doesn't make a difference. So this is the tricky part. I'm going to try and explain it as best as I can. The best we can do is make sure we acknowledge as researchers that this is a problem. So when a researcher decides to choose this group versus another group, we have to think about what are some of the differences between the two control groups that could have made a difference in our results. Because clearly there are confounders here. And I'm not sure if you watched the confounding video yet, but remember, confounder is a third variable or third variables that can impact your result. So in this case, I'm going to skip to the next slide. There's definitely reasons why the second control group might be different from the first. For example, it depends on who was home when they went to recruit in the second group for the neighborhood. It kind of depends on who was home. And then if you think about it, okay, if you're only selecting women who happened to be home when they came around, when the researchers came around to recruit them, maybe those women were less likely to work because they're home, which might, okay, this is just, we're just hypothesizing, maybe they don't have a job, which means they're less likely to have maybe insurance, and maybe they're less likely to have had regular checkups and pap smears. Now, there's a ton of other possible confounders. I'm just giving you one in this example. But you see how versus the control group in the hospital, these people clearly have medical coverage, right? And maybe they're more diligent about their health. So the characteristic of the control group in the first example is different than in the second. So to summarize this, selection bias in case controls really has a lot to do with choosing the control group. And we have to consider what are possible traits in the control group that could influence our result, that could cause a selection bias. So we're not going to go around and sample from like a million different control groups, although some people, I have seen a study or two where they'll have multiple control groups, which I think is probably really great, but it's expensive to do that. But what we do in the case control is we think about, well, what does the control group look like? Is that something that, is there something about that control group that could impact the result? So that's what it is. That's what you have to do when we talk about this, is what are the characteristics of the control group? All right. So here's just everything I just said is on this slide, so that's for your text. Let's move on to the last one, which is selection bias in cohort studies. So in this one, this has to do more with like loss of records or loss of participants in follow-up. So the example I'm going to give you has to do with inaccurate records for a particular group that we're studying. So let's say hypothetically there's a retrospective cohort study where we're studying occupational exposures or some sort of toxin or exposure in a factory setting, and the disease, let's say a sort of cancer. And let's say both the exposed and the non-exposed groups are enrolled based on their prior medical records kept by the factory's medical staff. So notice I made a little indentation here to say that, to note that the record keeping in the early stages of when the factory opened may not have been ideal, which is very true, by the way, right? If you're looking at medical records and you're looking, it happens every time. Whenever you're looking at much older medical records, there's always flaws, or they're not, the record keeping is not as good. Sometimes records get damaged, sometimes they get lost. So keep this in mind, right? This happens a lot. So now, consider the situation where people who developed the disease and were exposed to the condition of interest were more likely to have had their records lost. So it happens to be that the people who are sick are the ones who have their records lost or inaccurate. You're thinking, all right, so what, right? Well, the problem is, in this particular case, it may cause an underestimation of association between exposure and disease. So let's look at this with numbers. With numbers, you'll be able to see it very clearly. So let's say this study is conducted, we collect the data, and we have 50 diseased people in the exposure group and 750 in the non-diseased. and that brings us to 800 in the exposed group. And then we have 50 diseased people non-exposed, but we have a lot more non-diseased, right? 950, and then we have a total of 1,000. And a lot of times, you know, we like to match these numbers, by the way, but it almost never happens. But just, you know, in an ideal world, these would be matched. But notice we have less people in the exposure group. And again, and this is partly because, you know, hold on one second. I just want to make sure, yes. So this is partly because of this issue of the lost records, right? So we have all these lost records that happen to be exposed. So that's what I'm saying here, right? So we calculate the RR, you get a 1.25, right? This means that those who were exposed had a higher risk of being diseased, but that's what this means. It's higher, that's greater than 1. It's not 1.0, right? It's 1.25. So, but again, let's keep in mind that we're missing 200 records from the exposed group because they were poor quality or they could not be found. This is a little tricky. This one is trying to figure out the true relationship if all the records had been available. Now, this is something very tricky that epidemiologists and analysts are trained to do, and they arrive at these estimates using fancy statistics and imputations and things that I'm not going to teach you about. But I just wanted to tell you that this basically comes from hypothetical mathematical situations where we're able to kind of get a guesstimate. Had we had those records, what would we have calculated as the RR? So don't worry yourself about that. But I don't want you to feel like this is coming out of thin air. It's not. People would calculate this. So let's say had we had those 200 records and we were able to fill in this number up to 1,000, and we discover that actually 150 would have been diseased. So this is greater than the 50, right? There's 100 more people with the exposure and a disease. And what happens is when you redo the RR, you get a 3.0. So the true RR is higher than the RR we calculated. So there's a selection bias here. And the selection bias is basically that we're selecting, you know, it's an unbalanced, right? We've collected more data on the unexposed and the exposed group. And then when we do the fancy things to figure out, well, what should have it look like, then we see that there's an underestimation in our calculation. So we want to avoid this, and it's really tough. There's almost little or nothing we can do other than doing a statistical estimation and then comparing it and writing it up and saying, well, we think that there might have been a selection bias here, and we just talk about it. Scientific articles should disclose this if there is a selection bias. To tell you the truth, I don't always come across it, but occasionally people do cover it. So if it's a good epi journal, they will cover this. And okay, so when you're interpreting your study results, what you want to do is ask yourself these questions. Given the conditions of the study, could any bias have occurred? So the reason why this is tough for you guys is because you're not conducting the research yourself. And I understand that, okay? I don't expect you to come up with super detailed answer to these things, but you want to think about, you know, are there possible errors in the methods, right? In the way the data were collected? Are there possible biases that could occur with the interviewers? Are there possible biases in the selection of the control groups or of the participants who are, you know, getting tracked? Is there bias present? This is kind of tough to figure out, but you want to just take a guess, right? That, you know, is there, with the information you have, is there bias? Are there potential consequences? The answer is yes, there's always consequences. So the consequence to having any of these biases we've discussed, whether it's any of the observationals or the selection biases, they all cause a change and your measure of association. So your RR and your ORs and your comparison of prevalence, always. So I want you to keep that in mind. This is why we're talking about this, because we don't want an erroneous RR or OR. Then the last thing, which I already promised you would have in a different mini tutorial, which is what is the direction of the distortion? In other words, what is the direction of the bias? Is it towards the null or away from the null? And the only way you can figure that out is if you have the true RR and the biased RR available. And you'll see what I'm talking about when you look at that mini tutorial. Alrighty, so I think that's it for this one. And again, trying to keep mini tutorials short as possible. When you see how many, there's about 5 this week. So I really had to break it all up because each of these is pretty heavy concepts. But hopefully you enjoyed it, and it helps you on your final exam and on your quiz too. So happy studies, and I'll see you next time.